Nkengasong. He is the director of the Africa Centers for Disease Control and Prevention, which in short we call AfricaCDC. And to his right, he is joined by Dr. Benjamin Djoudalbaye. He is the head of policy, communications, and health diplomacy in the AfricaCDC. We will start by giving Dr. John a chance to take us through the points that I've mentioned to you, and then we will then go into a Q&A, during which Dr. Benjamin will join. The way that you can ask your questions is through using WhatsApp number +251 9455 02310. I'll take that number again. +251 094 55 02310. Or you can simply raise your hands on the Zoom link that you are using. So without much ado, Dr. John.
So thank you, Wynne, and dear friends, colleagues, brothers and sisters on the call. This is we are celebrating many things today. We're celebrating the Africa Day, and we've come a long way. And I will rather leave Dr. Benjamin in his capacity as the head of policy and diplomacy to walk us through some key milestones that we've achieved. The journey that we've journeyed since 1963. If you brought the people that sat in this room in 1963 and you talk to them about the health challenges, they would actually see a very different continent. They will see a continent that has progressed significantly in terms of health outcomes, but they will also see a continent that is challenged significantly. We've made tremendous strides, remarkable progress, but we also still have remarkable challenges in front of us. And our four parents will be looking up to us and saying, we preach about African unity, and you preach about the integration today. And I'm sure they'll be whispering in our ears and saying, health has to be at the center of your continental integration agenda. They will be whispering in our ears and saying, health has to be at the center of your free movement of people agenda. And they will be whispering in our ears and saying, be careful, health has to be in the agenda, in your radar, as you talk about your open skies agreement, so that you can achieve your Africa We Want goals by 2063. So let me just say that when they sat in this room in 1963, they were dealing with trypanosomiasis. They were dealing with malaria. And they were dealing with very basic things like immunization of measles. That's why some of their very first commitment was on immunization, that all of us had to take those immunizations in order to survive. If you bring them today, they'll be wondering aloud and say, what happened? Where did HIV/AIDS come from that has killed over 20 million and above Africans? They'll be shocked that Ebola is a new disease that you are telling them that they didn't know in 1963. They'll be very, very amused and confused even today as we speak on the 25th, on the anniversary, that we are dealing with a very strange virus that started in China and within 4 months or even less, it was on our continent. And it's already taking foothold there on our continent and disrupting things that we are struggling with, including immunization, what I call the unfinished business of immunization. But they'll also be pleased to note that we are making progress in strengthening our own health systems, in developing our national public health institutes, that our capacity has developed to the extent that we have many more professors than when they were sitting here in this room, professors in medicine, global health, and other aspects there. So I think the story today is a story of hope. It's a hope story that we can celebrate, that in as much as we took away some of the things that challenged them in 1963, we have new challenges, and that's what defines a generation. Each generation has its own challenges, and our generation's challenge, as we speak today, is to beat back COVID-19 in solidarity, using the African spirit and using the African slogan that says, if we want to go further, we go together. If we want to go faster, we go together. And I think this is what we are here today to preach about the African solidarity. I will let Dr. Benjamin walk us through some significant milestones that occurred in the journey of from the African, the Organization of African Unity to the African Union today, which we are enjoying the birth of the AfricaCDC and many other promises and visionary ideas like the African Medicine Agency that will be delivered soon. Dr. Benjamin.
Thank you very much, Dr. John, and let me seize this opportunity to wish fellow Africans happy Africa Day. We are very pleased to be here with you on this webinar. As Wynne introduced, health has been a major preoccupation for both the African Union as well as its predecessor, the Organization of the African Unity. And let me take you a little bit back. In May 1963, the Charter of the African Organization of the African Unity, provided for the establishment of the Commission on Health, Sanitation, and Nutrition, and the first conference of independent African head of state and government, which took place here in Addis Ababa in May 1963, agreed to set up a committee of experts to document health problems facing the continent and propose solutions. So that was back in 1963. In September 1969, the WHO became the first United Nations organization to sign cooperation agreement with the OAU on 24th September. Then, in 1987, the Assembly of the AU head of state and government adopted a declaration of health as foundation for development and a resolution on universal immunization in Africa during their 23rd ordinary session. This was meant to fast-track health and development in Africa. In 1991, the focus was on disease-specific intervention, as Dr. John mentioned. In that year, the Assembly took a landmark decision which shifted the focus to strengthen health systems. Slide. In April 2007, the conference of the AU Ministers of Health took place in Johannesburg under the theme Strengthening of Health System for Equity and Development. It was during that conference that the first Africa Health Strategy was developed. And this Africa Health Strategy was endorsed in 2008 by the 11th session of the Ordinary Executive Council of the African Union. In 2001, we have several declarations in Abuja. And the declaration on rollback malaria and HIV, TB, and other related infectious diseases were adopted respectively by the head of state and government. And they reaffirmed their commitment to provide the necessary political environmental within which HIV, AIDS, TB, and malaria can be addressed, and the famous 15% of allocation of the national budget of health, which everybody is focused on. But this declaration is about many other things. And coming January 2005, in order to promote sustainable access to affordable medicines, the fourth ordinary session of the AU Assembly, which took place in Abuja, requested the African Union Commission within the framework of NEPAD to lead the development of pharmaceutical manufacturing plan for Africa. Slide, please. In May 2006, at the special summit convened by President Olusegun Obasanjo in Abuja, the head of state took stock of the 2000 and 2001 Abuja Declaration in May 2006, and they called for extraordinary action to address HIV, TB, and malaria through universal access to prevention, treatment, care, and support, which is known under Abuja Accord. In 2015, the meeting of the first, in July 2013, in addition to the revised strategy of the Africa Health Strategy, the head of state have decided that we should include a strategy on innovation and research. And in 2015, the specialized technical committee on health, population, and drug control recommended that a revised Africa Health Strategy be developed for the period of 2016-2030, and this is the strategy that we are currently implementing. In January 2015, the Africa Agenda 2063, which is a framework formulated for the purpose of guiding Africa's development in the next 50 years, was adopted by the African Union Assembly. Its first 10 years implementation also was adopted in June of the same year. Now, in meantime, the Africa, before going to the Agenda 2063, in 2014, the head of state and government in Abuja have decided to establish the Africa Centers for Disease Control and Prevention. And Ebola was just the first track for the establishment of Africa Centers for Disease Control and Prevention. So now the Agenda 2063 has several aspirations and goals, but I just want to focus on the goal 1 and goal 3 of the aspiration 1, which is the high standard of living, quality of life, and well-being for all. Health, and the second one is on healthy and well-nourished population. As you can see, health is at the center of the Agenda 2063. Now, going forward, we have written a piece on universal global health in 2017, precisely in November 2017, shattered the future of the health on the continent. And for us, is to harness public health assets in Africa through what we call the regional integrated laboratory, surveillance and laboratory networks, and strengthen the National Public Health Institute, support health decision and policy through quality data and science, build public and private philanthropy, partnership to leverage resources, coordinate and enhance partnership with Africa health workforce capacity. And today we successfully launched the Kofi Annan Global Health, AfricaCDC Global Health program. So this is one of the concrete things that we are doing. And when we put all these things together, it will help us strengthening systems and health and health systems. So let me stop here and we can take some questions and move forward.
Okay. Thank you very much, Benjamin. So I think we've come to the point where we engage with you in terms of what has been highlighted and any other issues that you might want to talk about that are related to those points that we outlined at the beginning. As I mentioned, the way that you can ask your questions is by sending them to WhatsApp number +251 9455 02310, or you can raise your hand as an indication of your desire to speak. Nken, can you advise who we have online? Okay, while we wait for Nken to do that, Benjamin, maybe you can talk to us a little bit about this 15% on health. How are we doing as a continent on that?
Okay, thank you very much, Wynne. This lot of work has been done. You know, when we have tried many years ago to look at the percentage of the national GDP allocated to health, less than 10 countries in Africa met the goal. And let's say that the 50% was decided without looking properly into how to measure it. Some countries thought that it is, including the funding coming from outside the continent, should be also tabulated, take into account for the 50%. So we have seen that there is a lot of challenges for the countries, and it is when we are trying to report, it is mainly forth and back with the countries. So we have decided to move to what we call a scorecard with a set of indicators. So every year we publish what we call the Africa Domestic Health Financing Scorecard with some key indicators taking into account the national budget allocation to health. And today we have a very clear idea of how many countries have reached the target and how many are on the track and those who are completely off track. We know that year after year, many countries are making a lot of effort. When you compare the situation back to 2001 and today, 2020, it is like you are comparing the day and night. So many countries, even those who were lagging behind, are putting a lot of effort in strengthening their capacity. Now, last year in 2019, there was what we call the Africa Leaders meeting on domestic health financing, and we have a champion. The champion is His Excellency President Paul Kagame of Rwanda, who is he's a champion for domestic health financing on the continent. And under his leadership, we are establishing what we call the domestic health tracker, which is work in progress, and we are establishing at the regional health communities what we call also the hubs for the domestic financing hubs. So the regional community, economic communities will support the countries tracking their expenditures in health domestically. So this is what I can tell you in terms of progress, but we have seen a lot of improvement in terms of national allocation to health for the last almost 20 years.
Okay, thank you. We have Malesela Maubane, who wants to make a contribution. Malesela? Hello, Malesela?
Unmute, and I was thrown out for a moment there. Yes, good evening from South Africa. Yes, my name is Malesela Maubane, the immediate past president of the Public Relations Institute of Southern Africa. Mine is just first appreciate the sessions and the Africa Communications Week to start with. But let me just, there'll be half comments, half questions. To say the founding fathers of the African Union, the forerunner being the OAU, had a vision of a united Africa. How far are we in making sure that as Africa, we are united in terms of peace and resources? I know there's been a launch, the launch of the Africa Free Trade area will take us forward, but how far are we in realizing the vision that the founding fathers of OAU and now AU head. And another one is just to say these kind of sessions are really appreciated. But also in conclusion, just to say, we're talking about African solidarity in the age of COVID-19. To say, how are we to ensure, as the former and late Burkinabe President Thomas Sankara said, he who feeds you controls you, to make sure that as Africa, we are united in dealing with COVID-19, and as much as we must have partnership with the countries outside the African continent, but making sure that that unity, and also making sure that the resources that they are bringing into Africa, they do not end up in colonizing Africa again. Thank you very much.
Benjamin.
This we need to have a political answer.
Yeah, but on the issue of the goal of unity of Africa, I think you can.
No. In terms of the goal of the unity of Africa, we are making a lot of progress. And I can just take an example. For instance, the implementation of free movement of people. We have seen a lot of effort on the continent in the recent years. And many countries now today, even including Ethiopia, where we are living, it was just 1 year ago, it was not possible for an African to arrive in Addis Ababa without getting the visa, before arriving in the country. But today, any bureau of Africa, of an African passport, can get the visa just upon arrival. And we are gradually seeing the situation all over the continent. It is a reality in Ghana, it is a reality in Benin, in Rwanda, in so many places. That is just one. When you take the regional blocks, East Africa today, if they have implemented, the unique passport in East Africa. So with your East African passport, you can go anywhere, you can establish anywhere, you can do business, you can be employed, etc. So we can see that many things, many efforts are being done. And if you bring under the umbrella of the continental organization, it is a lot of improvement, which was not possible a few years ago. So this is just to just name a few examples.
I think the second issue that Malebane had was on the sustainability of the funding for our COVID-19 preparedness and response.
Yes. Okay. For the sustainability of the funding that of the COVID-19, what we are doing at the continental level here is to support the member state, but we are not going to respond to all the needs of the member state. And in each country, they have a COVID response team, and many countries move forward to establish even at national level COVID funds. So at continental level here, the sustainability is the establishment of the AU COVID-19 response fund. And as we are speaking, there is a concept that is ongoing, during which any African citizen can make contribution, and with the hashtag give a little. So even if it is $1 in whatever denomination, Kwanzaa, I don't know, any currency that is available, you can just make a donation, and that is one way of sustainability. The other way of sustainability is also to the involvement of the private sector in the countries and at continental level. The governments cannot do everything themselves, but they need to also support from the private sector. So we need to involve whatever we are putting in place. We need to bring the private sector on board. We need also to ensure sustainability, to increase the allocation of the national budget. That is the only way if you want to get rid of the support, because we know there are many other sectors that we don't require support from outside, but when it comes to health, we are just crossing our hands, waiting for the support from outside. But we are seeing a lot of change happening on the continent. Countries are taking their destinies in their hands. So that is a very good development.
All right, Andy Martei. Andy, you have the floor.
Hello.
Hello, Andy, we can hear you now. Please go ahead.
Yeah. Okay. Thank you. So I'm Andy from Ghana, and I would like to make an inquiry into the Agenda 2063, the health goals. We noticed 2 health goals in the agenda, the goals for the agenda. But my problem is that these goals are not entirely measurable. They seem a bit ambiguous to me, sorry. So if you say good health, or if you say well-nourished citizens, is there any measure to how we would determine that we've actually reached this goal? Because to maybe someone in one location, well-nourished citizens is just 50% of the continent. In another part of the continent, a well-nourished continent is 70%. So these goals to me are a bit just hard to, they are relative in a way. So what is the actual approach, or what is the target, if there is any? And also, secondly, after the Abuja declaration, I want to know if there is any new measure in place to replace it, since I think it was a 10-year, if I'm not wrong, from the presentation, it was a 10-year program, and that has elapsed. Has it been replaced, or has it been restarted, or what's the way forward concerning that? Thank you very much.
Okay, I'm inviting you to visit the AU website, and you will know that, yes, I presented the broad. The time that we have allocated for this webinar will not help us dive into the subject, but we have what we call the first 10 years implementation of the AU Agenda 2063, which identified priority areas and set a specific target to define strategies and policies measures required to implement the Agenda 2063. And this also provide information to all key stakeholders at national, regional, continental level on the expected result outcome for the first 10 years of the plan, and assign responsibilities to all stakeholders in its implementation, monitoring, and implementation. So we have a comprehensive plan in place for the Agenda 2063 with measurable and smart goals and indicators. Everything is in place for the monitoring of the Agenda 2063. In terms of the Abuja, we have several Abuja declarations. The recent one that said that the last one was 10 years ago, but it has been replaced by what we call the AU catalytic framework to end HIV, TB, and malaria in Africa by 2030. So that is what we are implementing currently. Over.
All right, Peter van Heusden. Peter, are you able to talk to us? Peter van Heusden. Okay, we might be having problems with Hi, Peter. Yes, we can hear you now. Please go ahead.
Sorry, I wasn't sure if my audio was working. No, I was asking on the question interface. We're seeing now, just when we are needing a vaccine for COVID-19, I'm actually seeing quite an expansion of the anti-vaccine movement on the African continent, in part because of the historic relationship with exploitative medical practices on the African continent from colonial days, but also driven by international lobbyists. So, yeah, it's quite a health threat. Do you have any thoughts on how to monitor and address this anti-vaccine movement?
Okay, Dr. John will take that.
Yes, first of all, about vaccines. I mean, everybody should. I think we all know that vaccines are perhaps the most potent tool that we have in public health, and a period. I mean, I could just say that and end there. We also know that vaccines are safe. And we also know for our continent that even back when vaccines are available, we still have a challenge in immunization, in coverage. So if we ever let our guards down and the anti-vaccine movement takes over, then we will be in serious challenges there in terms of the security of our own existence as human beings, because it's a threat that we cannot even fathom the idea of living in a world where vaccines would not be administered, period. We have to take the movement, the movement, what I call it, the anti-vaccine movement, seriously as a threat, and do everything possible to counter that threat by spreading the right information. And it is everybody's responsibility and accountability to be part of the movement to blunt that anti-vaccine movement, especially on our continent. People have exploited our continent because of the fact that people are not very literate enough to understand some of these concepts. And they've also exploited it in our social, cultural, and political divides, where in many situations they will go into settings and then say that the government is going to vaccinate people because they want to sterilize them. So they play into cultural fears, or they say that they are vaccinating them because they want to introduce diseases into that community because they don't like them. That has to stop. It is at the collective responsibility of all of us as a continent, because of what is at stake, to make sure that we stand up against those kind of movement at the community level, at the political level, and at the civil society level.
All right. We started off talking about solidarity in our preparedness and response to health crisis on the continent. Perhaps you might want to tell our viewers about how Africa is working together as a continent rather than individual states in this effort.
Perhaps I would say that when we are still early in our battle, which I've characterized as a war many times, and I do that in a very deliberate fashion, a war against COVID-19, that when the history will be written, and there are usually three parts of history: those who make history, those who write history, and those who read history. Those who write history, I hope that they will remember that this period, that Africa came together as one, and to coordinate its effort at the highest level of the continent, led by the Bureau of Head of State, where they have met multiple times, at times almost on a weekly basis, just to coordinate their efforts, not just in the health sector, but also in the financial, economic sector, transport sector as well. I think that is remarkable as a continent of 1.2 to 1.3 billion people. The continent as a whole was, and credit must be given to the chairperson of the African Union Commission, Chairperson Moussa Faki, that of having the vision and wisdom very early on, as early as on February 22nd, where only Egypt, one country on the continent, had reported a case, to rally the continent and say, fellow Africans, we see a threat, and this threat is significant. Let's come together and develop a joint continental strategy, a joint approach that is underpinned by ability to coordinate ourselves, cooperate amongst ourselves, coordinate ourselves, and then communicate better amongst ourselves. I think that is remarkable, and it was very visionary on his part to have done that. In practice, it happens that the task force that the chairperson established is operational, it's live, and perhaps it is not an understatement to say that this is the only continent that has a continent-wide task force that is actually operational and has led to the implementation of very important measures on the continent. We recognize, just to end, that this battle will be won at individual country levels, but the overall celebration of the victory will be done at a continental level. What do I mean by that? There's absolutely no way that Kenya, for example, will say, well, we eliminated COVID-19 in Kenya, so we can now open our airlines, and our airlines will go around and fly and then come back to Kenya. Of course, you know that is, I mean, you can't be that naive. You know that it has to be that the entire continent is clean up of COVID-19 before your airlines can go to destination where they used to go and come back. Otherwise, you start over. You bring one case of COVID infection, it starts the outbreak, it starts the pandemic completely altogether. So that's what I mean by we have to win this battle at individual country levels, but celebrate the victory continent-wide.
Thank you for that. We have a question from Pamela Kumba of SABC Channel Africa. And Pamela says, I would like to know, what is your strategy to fulfill good health for all in Africa when some countries are still not investing in health infrastructure, especially in the remote areas?
So, Pamela, good to hear from you, and happy Africa Day. Health is treasure and is the pillar for any development. There's absolutely no way that any country has ever developed while neglecting its people, the heart of its people, because that is where your capital is. Your most precious capital is in the heart of the people. So we have to get out of this crisis very differently from the way we got into this crisis. There are certain commitments that the leadership of the continent has applied itself to or agreed on. Like in Abuja, the head of state and government met and agreed that there will be a certain percentage, I believe 15% of their income, gross domestic income, applied for her. This is the time for us to have an honest dialogue and say, we cannot continue to kick the can down the road and treat her as if it is a favor that we are doing to our people. We have to lead this battle with a whole different thinking, what we are calling a new public health order that begins at home, which also says that you cannot mortgage your own health, security, and well-being to donors or to partners. It has to be yourself first. And I'll go back to the commitment that we made in Abuja and say, this is time for us to be accountable to each other and have peer pressure and measures so that we actually protect the health of our continent. Otherwise, in 2050, when the population of our continent will be 2.4 billion people, where we are truly supposed to be harnessing the demographic dividends and be that force of the future, the continent of the future. You cannot be the continent of the future with sick people all around, where disease are threatening you, where you cannot provide basic needs, not just in the capital cities, but at remote areas there. I mean, basic vaccination needs, basic drugs at both the capital city and remote areas there. So, in short, our dream of being the continent of the future, because of our sheer size, by 2050, 1 in 4 human beings on Earth will be an African. That's power right there, if we know how to harness it, and it's by investing in our health, such that we know that it's not a cost, but rather an investment if we put our resources into health.
Thank you very much. I think we'll go back online. We have Chika Nya Etok. Chika. Hello, Chika. All right, I think we'll still try to get hold of Chika. Can we try Sarah-Leigh Elago?
Good evening. Can you hear me? Good evening. Good evening. Good evening. Can you hear me?
Sarah-Leigh.
You have to unmute.
Hello.
Okay. I understand, Chika, if you can unmute your microphone. Hello, Chika.
Hello. Hello.
Okay, it seems like we're having a problem with our with our connectivity.
Good evening.
I'm being told that you should unmute your microphones where you are.
Good evening. I am unmuted. Can you hear me now?
Hello.
Okay, Chika and Sarah-Leigh, if you can unmute your microphones, but while we're waiting for that, maybe we could also move on to discuss about the possible thinking that is there around a new global health order. Do you want to give us a little bit of that?
Sure. I think I keep saying we cannot get out of this COVID crisis the way we came into it for several reasons. First of all, the continent has to begin to write some lessons now on what we've experienced since the last 5 months. We've only lived with this crisis for 5 months, but to me, it feels like we've lived with it for 5 years. And the reason it has been so painful is severalfold. One is that we as a continent of 1.2 billion people do not just lack diagnostics, but lack the ability to produce diagnostics. Where maybe no country in Africa, a continent of 55 member states, produces diagnostics. When I was in graduate school, as learning biology, when I needed to do my test, I did it myself. So I would go to the lab and design the test and use it, but I didn't have the means to scale it up. So it's not difficult. So the first thing that we need to think of as we talk of a new public health order is to say, how can we develop our own diagnostics such that we are not at the mercy of others when a new infection occurs. Second is the ability to produce efficacious drugs. As we speak, as a continent, we are relying and hoping that drugs will be developed elsewhere and then we'll use them. It cannot be that way. A continent that projects to be a continent of the future, with 1 in every 4 or 5 by the year 2030 being an Africa, continue to rely on externalities for our drugs, importing almost 99% of our drugs. Thirdly, we need to be able to scale up our ability to produce vaccines. As we speak, we are relying on the fact that China, Europe, or the United States, or somewhere else to produce vaccines against COVID, and then we'll use them. A continent of the future cannot be that. So these are all ingredients that we have to put together and have an honest conversation and say, hey, continent of the future, can we be able to apply ourselves in such a way that we use a continental free trade agreement to advance some of these important critical elements that determine our future and our safety? I think that is a conversation that we need to have going out of this crisis. Then we look into the workforce. As we speak, we need 6,000 epidemiologists in order to secure us. If we go by the formula that says we need 1 epidemiologist in every 200,000 population. We currently have 1,400 to 1,500 epidemiologists. So we should step back after this crisis and say, how do we train an army of disease fighters? And not in a trickle-down manner where maybe Cameroon treats 10 epidemiologists this year or for 2 years, then Chad trains another 10. I mean, that we really look at them an army, because this crisis is teaching us that we are at war, that the number of people that it has killed, okay, it will be more than several civil wars that have happened on the continent. That if we apply ourselves that way and say, well, if we are at war, we treat it differently. We recruit thousands of young people, treat them and go to war. And then we are fighting a virus, which is even a deadly enemy we are not seeing. Then we use trickle-down approach in doing it. Those are all elements that we need to pull together and argue for a new public health order for our continent.
All right, thank you. Patricia Makisha. Patricia, if you have a question or comment.
Hello, can you hear me now?
Patricia. All right. We seem to not have, or at least have lost Patricia. Let me go back to either Chika or Sarah.
Hello. Can you hear me now?
Hello? I see Sarah speaking.
Can you hear me now?
Hello? We cannot hear you.
I've been muted by the host.
Hello, Sarah. Hello? I'm sorry, but we cannot hear you. If you're able to send us your question or your comment, you can use our WhatsApp number that we have advertised, and that's +25.
But I've actually sent a few questions and they haven't been answered.
I can see you. Okay, I hear you now.
Can you hear me?
Yes, please go ahead.
Good evening and thank you for the opportunity. I'm Sarah-Leigh from Namibia. I have 3 questions, but I'm going to start with the most pertinent question. You know, like if you look at the current situation, which is COVID-19, all over the world, and you look at Africa and you think to yourself, amidst COVID-19, you know, how are people with no access to basic necessity like clean water and quality health, how are they going to fight this deadly virus if their governments and their states and their presidents and their leaders haven't given them basic access to these necessities? That's the first question. Because if you look at some parts of Africa, there are villages and there are people that don't have access to clean water. And one of the basic regulations of COVID-19 is to constantly wash your hands. So how are these people going to wash their hands if they don't have access to clean water? And if they are to contract or get infected with COVID-19, they already don't have access to quality health. What is going to happen to these people? What mechanisms are in place from the AU and the health commissioner or the health department to ensure that everybody all over Africa has access to clean water and quality health? That's the first question. The second question has to do with Agenda 2063. Now, if you look at this agenda, for example, you realize that this agenda was crafted. And I would like to say this with, you know, with so much respect, but it's a fact. It was crafted in isolation from young people. You know, people that are going to lead this continent further, young people that are going to become, you know, the next presidents of their states have been excluded from this document. So now we have a document or we have a policy that young people do not fully grasp. So when their time comes to lead, it's like we are going to be the most overburdened young African leaders because we'll be sitting with policies and documents we have no idea for. So the question basically is, what mechanisms are in place from the AU, for example, to ensure that young people, that young leaders are included in all these, you know, decision-making, like platforms, and what mechanisms are in place to ensure that young people can actually be the driving vehicles of this agenda? Because if you look at the Abuja Treaty, if you look at Agenda 2063, if you look at the African Continental Free Trade Area, young people haven't been fully and properly consulted and included in these serious and strategic and decision-making bodies. So the last question is, if we look at the Africa Free Continental Trade Area, we have about 26 states that have signed or that have bought in this beautiful idea. to make Africa self-reliant and self-sustainable, the original Pan-Africanist, ideology. But we have about 20-something states that haven't bought in this idea. Why is the AU allowing member states to prolong and delay all these things? Thank you so much.
Thank you very much for what you mentioned. I'm going to take on the Agenda 2063. Allow me to strongly disagree with you. If we have seen one of the policy documents that has gone through a thorough consultative process and participative process in Africa, is the Agenda 2063. When the Agenda 2063 was developed, consultations were made at continental level, at regional level, at country level, and at even subnational levels. And it was a compilation of all the different segments of African society that was brought together as Agenda 2063. And I took part of this consultative process. So I totally disagree with you that you said it was not developed in consultation and the young people was. If there is one of the institutions across the world that is putting young people at the center of the development agenda, is the AU. AU has a division of youth. We have a youth program here. Even we have even champions of the youth at the head of state level. President Idriss Déby of Chad is the champions of the youth in Chad for the African Union. So the Agenda 2063 and the issue of the youth is high on the continental agenda. That is what I can say on that one. So for the other one, I will.
So let me compliment what Benjamin has said. I know that we are a big continent, 1.2 to 1.3 billion people, and if people don't pay attention to certain things, it might slip past you. But there's always room for everybody to contribute. Just today, you probably have seen in the news that we launched the Kofi Annan, the Global Health Leadership Program. And one of the components, one of the three components there was a virtual leadership academy, whose only purpose is to provide a platform for brainstorming of ideas, whose purpose is to provide, to be a think tank where everybody, when I mean everybody, I mean the entire spectrum of the continent, can share ideas and bring ideas that will be harnessed, and we as AfricaCDC and the Commission can use those ideas there. So I mean, it's there's huge opportunities there for continuous participation, and just so that you know, we are very sensitive that health should be looked at it from a gender perspective. Should we look at it from a human rights perspective and an economic development perspective? So the field is still wide open for that, for your input. Secondly, it's about the basic needs, and I think of the people, including water, access to water, and other things. That I started off my remarks earlier today by saying that putting our resources into healthcare should not be seen as a cost, should be seen like a true investment. COVID-19 has exposed all of that in a remarkable way, not just in Africa, but across the world, that this is truly an investment. If you reinvestment, which if economists, I'm really hoping that that dialogue will also happen between health economists and health professionals to say, what is the return on a dollar on a return on investment by putting in $1 into building a health facility there? I think it's probably going to be like $30 return on the investment if we do it well. I think, I mean, that is, I submit that if Africa has to leapfrog itself, We have to invest in our people, the healthcare of our people. And I use the word healthcare deliberately. Not necessarily public health system, not necessarily access to healthcare that would favor a certain category of people, but that will be for everybody across who deserves to be treated if we want to be the future, the continent of the future.
We have Tanya Demboleta. Tanya. Hello, Tanya. And I see that Chika is still online. Could we try you again? Chika?
Good evening. Good evening. Can you hear me?
We can hear you now. Thank you.
Thank you very much. Happy Africa Day.
Thank you. Thank you.
Quickly, I just want to talk about the need for a coordinated strategic communication framework as part of the response to the COVID-19 response. I appreciate what Dr. Nkengasong said earlier. Africa is the only continent that has a continental task force. That is commendable, and we are happy to know that. However, because of the large infodemic that is out there, with a lot of conflicting comments as to the cause of the COVID-19 pandemic, the preventive measures to apply, and the treatment, there is a lot of doubt, and a lot of people are doing different things, some right, some wrong, some even outrightly dangerous to their health. So do we have, or can we have, a coordinated strategic communication that goes out to the whole of Africa to say this is the authentic information as to the cause, as to especially preventive measures and treatment measures? In view of all the claims from everywhere, from people who claim that they have developed a treatment, and some even claim that they have developed vaccines, but we know that it's not possible for there to be a vaccine at this time. So what I'm saying is, how do we push the information, especially to the poor, ignorant Africans in the rural communities of Africa, so that we make sure that as much as possible, as we say, we flatten the curve at least across Africa. Secondly, quickly, I just want to say, how can we enforce the 15% budgetary allocation to health by countries, which they signed on in Africa, in Abuja some years ago? Because it looks like it depends on how any country feels. If they feel like they can do it, if they don't do it, there are no penalties, you know. So really, why would they do it? Can't we have some kind of penalties, some kind of enforcement to compel the countries to do this? Because you can see the low level of emergency preparedness of African countries when this COVID came on stream. Thank you very much.
Okay.
So I'll divide the questions into two, and I'll discuss one part briefly, because I'm enjoying this conversation. I would like to hear more questions. Then Benjamin can talk on what AfricaCDC is doing in terms of risk communication. First of all, let it be clear that this is a virus that has emerged. Way before this virus emerged, we at AfricaCDC and the African Union Commission were discussing how viruses emerge, and that one of the greatest risks that we face as a continent are the risks that undermine some of our developmental agenda was the emergence of a virus. This was just as early as late as August or September last year. We were gathering people from trade and industry, the Economic Commission for Africa, and having those discussions there. One would have thought that we were prophetic. Why is that? I like that we leave this forum with some clarity that this is something that has happened. It is happening. We will win the fight against COVID-19, but there will also be another virus will emerge there. So let me take you down the history of pandemics. That in 1720, we had the Great Plague, okay, which almost killed half the population of Martei. 100 years later, in 1820, we had the emergence of the cholera outbreak in Asia. And at that time, it wasn't known as cholera because these things emerged. I don't even know what it is there. Then in 1918 or 1920, the Spanish flu occurred and killed 50 million people within 2 years. And now, 100 years later, the COVID pandemic is happening now. This virus is very dangerous. I'd like us to take it to our communities that we are dealing with an extraordinary, unprecedented danger. Let me put it in numbers so that it makes some sense. We have lived with HIV/AIDS for 40 years, 40 years. And over the course of 40 years, about 75 million people have been infected. So if you divide 75 million people by 40 years, it gives you about 2 million people infected a year. We've lived with this virus for only 5 months, and 1.5 million people have been infected with over 350,000 deaths. So if we continue like this, we'll find ourselves in 1918, where our 50 million people will die. Okay. So the reason I say this is that these are unusual times. We have to apply ourselves in a way that everybody says to themselves, I am a champion, I'm a COVID fighter, I have to take my own personal responsibilities there. It has to start at personal responsibility. We cannot dream about things that don't exist. Things that don't exist are, one, we don't have a vaccine. A vaccine will not be around before December. Let that be very clear. Last week, there was some good news that the phase 1 trials, I call that the eagerness to share good news. There were less than 10 people that were immunized with the standard. All what that told us was that their immune system, their body, so reacted to that. Okay, which was a good sign. It still has to go through what you call the phase 2, which is to test whether it is truly safe, to test whether it can actually begin to protect you, and then you scale that to phase 3. And then once that is done, even assuming that you have a vaccine in December, access to the vaccine to 7.9 billion people on the surface of the earth will be another challenge. So the point I'm making is that the tools that we have at our disposition, which is distancing, washing our hands, wearing masks and others, is what is going to protect us for now. So we go, I would strongly encourage, and I'll end here, that people go to our website all the time to get the right information. And if you get the right information, spread it to your community. Tell 2 people in your community the way to get the right information. The 2 people will tell 2 people, another 2 people will tell 2 people. And then in a matter of time, the whole continent will know where to go get the right information.
I think perhaps we have just 5 minutes to go, and we have 3 people who are waiting to ask questions. So perhaps let's give a chance to any one of them. We have Mohammed Harakat and Nkengasong. Are you online to ask your questions? We also have Tanya Bemoleta. Tanya? Hello, Tanya, are you able to talk to us? Tanya?
Hello, I hope everyone can hear me.
We can hear you quite clearly.
Yes.
We have just 3 minutes for
okay.
Yes, please go ahead. Hello?
Earlier on, it was mentioned about people's sentiments towards, I guess, like foreign nations bringing vaccines into Africa and testing it on Africans instead.
The sound is cutting out there, so we're not able to finish your question. In the last 2 minutes, do we have Mohammed Harakat or Nkengasong?
Ngumon here. Can you hear me?
Okay. Please go ahead. Yes, we can hear you.
Okay, good afternoon, everyone. Or good evening, even. Yes, so I just wanted to find out, find out, you talked about a coordinated African strategy, but I wanted to know if there is any kind of active collaboration in terms of research between African scientists to try and come up with a cure for COVID. That's the first thing. And then the second thing, I would like to hear more about what the AU is doing in terms of tapping into diaspora talent. We know that there is a lot of Africans involved in healthcare in the diaspora. I think apparently there's something like more Nigerian doctors in LA than there are in Nigeria. So in terms of developing a forward-looking healthcare policy for the continent, what is the AU doing to actively bring the minds of the diaspora as well into this plan?
Thank you very much.
So I will be very brief because I know that the master of ceremony is itchy to get us to the finish line. In terms of the diaspora, I think the AfricaCDC is the most outward-looking, engaging organization that exists on the continent now. It is your organization. And there are 6 working groups within the task force that I indicated, and there are so many diasporas that are participating. So I ask that if you're interested to participate and you're African, you should send us an email, and then we'll link you up to the chairs of the working groups and you participate. The key thing is what we characterize as active participation, where people don't come in on there and tell us what to do, but they take on duties and assignments and actually do them. It is your organization, and there are already many diasporas participating there. Secondly, the research, there are several groups there's also a research technical working group that is underneath the steering committee, and that is where we are coordinating so many components of research, working very closely with the African Science Academy in Nairobi. So the opportunities are there. I urge that people ask the right questions by sending us their email. Send us an email and we'll link you up and you can participate fully. The only ingredient you have, as I say, is that you're African or someone who really an African in the diaspora and has the commitment to participate in a sustained manner. We do meet every Tuesday at 4 p.m. So you have enough time anywhere in the diaspora to participate.
All right, thank you very much. I'm afraid that we've run out of time. Again, we apologize for starting a bit late, but we tried to make up for that by extending this session, which was initially meant to be 1 hour. I'm sorry for those who've not been able to ask your questions, but that WhatsApp number still remains available for you to put your questions and comments across. And that number is +251 945502 310. And as Dr. John has said, feel free to reach out to us at any point. So at this moment, let me thank the 2 panelists that we had, and that was Dr. John Nkengasong, the director of the AfricaCDC, and Dr. Benjamin Djoudalbaye, the head of policy, health, diplomacy, and communications within the AfricaCDC. I am Wynne Musabayana from the African Union Commission. Thank you very much for having joined us. And thank you to Africa Communications Week. Bye-bye for now.
Bye-bye. Ciao.